Speaking of emergency rooms, you've talked about how this would lighten the load on emergency rooms and law enforcement who often end up. Can you talk a little bit about that, how the need to sort of transfer care from those folks over to the mental health professionals?
We have law enforcement officials here today that I know can speak to this very well. I'll never forget calling up the head of the Cook County, the sheriff in Cook County, largest jail I think in the country in Chicago, and he had just hired a psychiatrist as the director of the jail. And we were working on our bill, and I called him and said, talk to me a little bit about this. And he said, well, it's real simple. Over half the people in my jail have mental health problems. So it made perfect sense to hire a psychiatrist to direct my jail. And I'm sure there are stories, constant stories about that and what's happening. So
this is Police Week, so lots of police in the nation's capital this week. But for the better part of 50 years, the emergency room and the law enforcement have been the de facto mental health delivery system in the country, and nobody is well satisfied, well served by that or satisfied by that. And more of our law enforcement agents in the country take crisis intervention training, realizing that so many of the moments they're involved in involve somebody who's not intending to do something wrong, but has a mental health problem that needs to be dealt with. And this we need to have, and we hope we're creating more options than, as Glenn said, a trip to the emergency room, which is a very, very, very short-term solution. The more places law enforcement have to work with, including drug courts and mental health courts, but the more places they have to work with in my hometown, Springfield, Missouri, the crisis intervention officers have for several years now carried an iPad that gives them 24/7 access to the Borough Mental Health Center. And I've been with the crisis intervention officers when they have been dealing with somebody, and interestingly, they open that iPad and they've got the person at the mental health center there to have a conversation with them right on the iPad. Suddenly you've got, as a law enforcement officer, you've got a mental health professional right there with you that you have access to, and it makes a big difference in how that person is dealt with at that moment, and maybe the right thing is more likely to be said. But law enforcement, probably the biggest beneficiary, in addition to the emergency room, of moving forward in the right way on this important topic.
Glenn, you mentioned your nephew was taken to the emergency room, but can you envision it turning out differently, I suppose, if he had been able to access treatment before that and could have prevented
that?
Yeah,
I think, yes, it would have been incredible. He wouldn't have had to go so far from home, and it wouldn't have been so terrifying for him. You know, for one thing, people who are in whatever state they're in, that they're confronted by police, or they're terrified. I've learned that from Kaylin. We can be scared of them because we're reading on their face this look that says you're either going to hurt yourself or you're going to hurt me. But what Kaylin has taught me is most of the time that look is, I am terrified and I'm in this place and I don't know what to do. I'm aware of it, but so yes, if there was a place where he could have gone to, locally, or certainly not 2 hours away, it would make a big difference.